All right, good morning, Chair Postman, members, Garrett and Bollendroff, staff and guests. The recording has begun and the lobbies are open.
Thanks, Justin. Good morning, everybody. We'll convene the Washington State Liquor and Cannabis Board Caucus meeting for December 13th, 2022. We got a brief agenda today, but I think interesting. Last week was the meeting of the National Cannabis Regulators Association, but I don't know exactly what those letters mean. Rick can tell us. And Rick was there, Jim was there, Ollie was there, as well as others on our team. And I heard little bits about it. It sounded great. So I thought we could just take a couple of minutes. I'd love to hear what each of your takeaways was there and what you learned. Rick, do you want to start since you're the principal of CANRA?
Sure, thank you. So as you know, we met on last week. There were 32 states present, about 160 attendees, and many of our staff had roles in presenting on panels. So one of the things I wanted to do, because I was thinking we'd do it at the next EMT, because I didn't give people much time, is because we got folks that were there that are not an EMT. So I'd like everyone that was present to come to the next EMT and kind of present what was the number one thing you gained from the conference specifically, so that you can kind of hear and everyone can hear, because it was a really full 2 days worth of information.
Do you mean EMT tomorrow?
No. I was thinking the next one, David. Okay. So I give people time to consider what they'd like to bring back to share with everyone. I mean, I could do it that way. Jim and Ollie, you were there, whatever you think. But I can just quickly share that Justin was part of a panel on structural factors in markets, basically looking at the way that different states put their markets together, some vertically integrated, some not, some with caps, some not. What the implications of that. And so I thought it was really one of the more interesting panels, and Justin spoke to our experience. And then the next one was a cannabinoid hemp update from the states, and Kathy Hoffman was on that panel. All the states, as we've talked about, are struggling with what to do. It all comes back to the Farm Bill. Toward the end of the discussion, there was a belief that, you know what we need to do as CANRA, the Cannabis Regulators Association, we need to be involved in working with the Congress on that Farm Bill that's going to be reauthorized, and see if we can help have an impact in changing and clarifying the hemp provision that created all the problems that we have today. So there seemed to be widespread belief that that's something that the individual states are struggling to find an answer to it. We're all doing it a little bit differently. We need to redo that that hemp provision in the Farm Bill. And then Penny Allen, one of our assistant AGs, in the afternoon was on a panel that's talked about litigation and case law updates, what's happening in many of the states. Really interesting discussion there. And then at the end of the day, Josh Bolender, our captain in enforcement, was part of a panel with other states talking about, you know, how do you deal with violations and sanctions? Why and when do you cancel licenses? And I thought that was an interesting discussion with one of our staff. And then the next day, Josh was on another panel, best practices for field surveys and inspections, compliance. Do you use youth decoy operations? Many of the things that we've been doing for years on the alcohol space that we're now doing in the cannabis space. And there was Jason Hansen from Oregon, who's co-chair of that committee, was the person who moderated that panel. That was interesting. So we had Justin, Kathy, Josh, and Penny on several panels. And so I'll stop there. And like I said, we'll come back with the team and share individually what we gained from the conference. I'll stop there. Thanks.
Great. Ollie?
Yes, I missed the entire first day because I was traveling. I was on the way there. So it sounds like in talking to folks once I got there that evening, I think that's great what Rick just suggested, because they were filling me in on a lot of things that had taken place on day one and the conversations and things. I was really the first Canna conference I went to, and I think it was in Boston, and it was actually just a pretty much a U-shaped round the room type. At that time, that's how small it was, because it was based on the states that was already legal and some looking to get legal. So to see how it had grown to over 32 states and the number of attendees, I thought it was one of the it was impressive to see how Canada has grown, and to listen to all of the states talk about the different way that they're doing things and the things that they're doing. The first one on Wednesday morning that I sat through and listening to some states talking about their packaging and what their packaging looked like. And I think somebody said they started out with everything had to be black and white or something like that. But just to see how people start out, how they evolve, and take a look to say, well, this didn't work, that didn't work. Why there was necessary. One of the things that Becky and I was listening to is when they were saying the importance of having a chemist on staff, and on and on. It's little things that you don't think of that you pick up at those conferences of why certain things are in place and the importance of those things. So that was really good to see and hear. The networking and talking to folks from other states, and one of the things, and everyone I went up to, I just said, what are you doing as far as social equity? How's your social equity? It's still the same. Nobody has gotten it right or got it at all. I think even though we are late getting in with social equity, we are still far ahead of the other states by having a program now that we are putting in place. So that was interesting. I have a lot of follow-up conversations with folks that want to hear more about our social equity program and what it is we're doing. But I'm anxious to hear from our staff on the meetings that I missed, because even on Wednesday, between having to leave and not attend because of board meeting, and then later that day I had 3-hour social equity meeting, the Cannabis Task Force meeting. It took me away from some of the things, but I was able to go back, meet people, and network and ask questions.
That's great.
Yeah, and I'll just add, I think that having staff who are present speak to us at executive management team is a great idea. I think, in fact, we should do that anytime somebody goes to a national conference, is come back and report back so we can learn. One of the values, I think, for me was it reinforces some of the things we're already doing well, and we're teaching other states from our own experience. And I think there's a lot of value in that and relationship building. But we also learned a whole lot from the sessions that we attended, things that we can consider. One that I really liked was a discussion from Illinois where they talked about person-centered policy making. And it really is around social equity, and they invest 20% of their tax revenues back into the community, particularly communities that have been impacted by the war on drugs. And my question to them was, well, can that be extended to other communities that have also been impacted? Because I do believe we need to reinvest in communities with some of the tax revenue. So communities that have been disproportionately impacted by the war on drugs, recovery communities, youth and young adults, etc. So just some really good conversation. And I also set in on one. It was actually a plenary on standards in lab testing and product safety that was extremely interesting. And that's the one where Ollie mentioned it already, where they talked about our staff and what type of staff we should have on in terms of chemists and folks who can help us develop some of these policies. So it was excellent. And I'm a big proponent of staff attending national conferences for the purpose of networking and hearing and learning what's happening around the country, but also sharing what we're doing here locally.
Yeah, for sure. I mean, part of it is what LCB does is pretty unique.
Yes.
And as you both said, we're far out ahead of it. So just the ability to talk to other people who know what we're doing it is valuable for people. I think and also we hear often, and I know other states do, people are always pointing to the other state. Well, why don't you do what they do? Or everything's going great in this state. And then you go and you get to hear what's behind that story a little bit. But I find that valuable too. So good. I'm glad you went. I see Justin, sir. I think we should definitely do what Rick suggested. But Justin, since you're there, could I ask you one question about that market structures panel that you were on? I just like what was your takeaway? Was there a sense of like one that's working better than others? Is there a market structure that people are evolving to, perhaps? What's your takeaway from that?
No, so as we were presenting on the infrastructure components, it was kind of a compare and contrast in some regards. New York is modeling their program after very similar to our program, but there are pros and cons to whether you're a 3-tier model or you're a vertical integration, and I think when people are looking, and some of the questions that came out as part of that particular panel had to do with, looking forward, how is this going to be impacted on the federalization issues? What about medical cannabis? Some of those types of equations come in. And so when we look at the structures that are in place, are you going to be able to help your current licensees, try to be successful once it opens up broader, or are we going to see, large companies kind of, come in and do things? So how are we positioned? Is the 3-tier model in a good position to be able to assist in a number of ways, and what kind of limitations are there as well? So it's really more around, exploring how did we get to where we're at? What kind of factors come into play? We went through many iterations in the conversation since 2012 that really play a part in this. And so we were able to kind of showcase that. New York, again, is trying to mirror some of that. Illinois was on the panel. They do things a bit differently. And I think a lot of the medical states are still doing things a little bit differently as well. So it'll be interesting with not to go into too much detail here, but between the infrastructure conversation and the standards conversation, when you're talking about what states are doing, those two are going to play an important role together as this thing moves forward, because how are states going to be able to interact with each other if standards are different, and those types of things? And so I think that's really something we need to look at.
Yeah. Jim, go ahead.
This is another topic, so if you have anything to follow up with Justin on.
No, go ahead.
So I just wanted to I'll get to attend, but I did follow up with some of the folks who attended, and it was on using data to inform regulations. And from the conversations I had with people following that, it sounded very interesting. And one of the areas that I'm really interested in is how do we use data and research to advance policy and to evaluate whether programs and decisions that we're making are in fact achieving the outcomes that we intend, or the intended outcomes. And so it was just really interesting. And there are states that have research sections within their agency, and I'm really interested in furthering those conversations and looking at how do we use data and research and evaluation within the LCB in the future.
Yeah, good point. Mary Segal and I met with public health and prevention folks yesterday, and one of the things they said was, the best sort of way to keep, we're talking mostly about cannabis, but all our products out of hand. Children is starts with good policy. It's not just an education program or signs. I mean,
Right.
it really is that programmatic thing. And, you know, Jim, you engaged in a conversation with those researchers we had about that, you know, what is, and generally I thought they gave us good feedback of our basic sort of foundational policies on these things. But that's, we need to look at that, what we can do. We had some good ideas yesterday too, that I think we're going to follow up on. So one thing I wonder from any of you was, what's the, you know, over under on federal action on legalization or decriminalization? Anybody there think it's imminent? Rick, did you hear from your guys there?
Well, I didn't hear anything more. I think people were so frustrated that the Banking Act, the State Banking Act didn't move, that people thought, my goodness, if we can't even get that to move, then how will we get the Congress to really take seriously legalization? So honestly, I didn't, unless some of you heard something differently, there wasn't a whole lot of encouragement there or expectation that the feds are going to move quickly. It was more, you know, we've got these issues like hemp cannabinoids out there, and how do we address that state by state? And how do we get the Congress to at least work that now, which that authorization is up? But I think, David, there wasn't a whole lot of discussion because I don't think people are really encouraged that something's going to happen like soon.
Yeah, that makes sense. So, okay, great. Well, I'm glad you all were there, and I look forward to the staff presentations that you suggested, Rick. And you know, Canra probably wouldn't be what it is without what Rick and a few other pioneers did. So it looks like it's really paying off, Rick. So nice job on that. And someday I'll try to attend one of those. That'd be good. So, okay. The only other thing we have is board member and executive assistant reports. And I do just want to talk a little bit about our schedule for, since the three of us can't sit and talk about these things otherwise, but staff says they don't have anything we need to act on between now and January. So that really means we don't need a board meeting, which then back up, there's no caucus then to prep for those. So at this point, I think we would cancel the board meeting next week, which is the 21st, and the caucus the next 2 weeks. So after tomorrow's EMT, essentially, we would have no meetings until the first of the year. But I wanted to hear from both of you to make sure you didn't have anything you were hoping we would cover or take action on before the end of the year. Okay.
No, I'm good with that schedule, David.
Okay. And then just as a reminder for everybody, but the three of us, we have these personal days we have to use before the end of the calendar year. So if you haven't done it, 2 days, is that what you're saying?
No, I was talking to somebody.
Oh,
We'll be done.
Dustin gave a hand signal. I was trying to figure out what it is. Okay, yes, you get one personal day. So let's use that too. And that would give everybody a break from the public meetings. And then as far as what days we all will take off, if vacations and things, we'll just coordinate through Dustin as always and make sure somebody's on backup if necessary. But should be a quiet time for all, I hope. And I'm hoping staff will take that time too, because once the session starts, it'll get busier. So with that, that's all we had. Dustin, anything to add?
Nothing additional. Thanks, Chair.
Okay. All right. Great. Well, with that, we do have EMT tomorrow afternoon, 1:30. So I'll see the both of you there and everybody else there as well. So till then, have a great
All
day.
right. See ya.
See you later.
Bye.
Bye-bye.